Welcome, my name is Ryan Belikov. Today we want to talk about back pain conditions with a focus on material handling. So the background on material handling with back pain is a leading cause of injuries according to OSHA and many others. Again, most of us are experience back pain. I see averages between 60 and 90%. That's pretty broad. So most of us will have back pain at some point in our lives. At this point, prevalence, if you ask someone, if they currently have back pain, 5 to 30% of the population would say yes. And then a period of prevalence at 17%. So back pain is very common, especially in the workplace. So if we look at workplace injuries with the back, there's over 5,000 every day that occur. So they're occurring all the time. Um, Big one is 6.5 million people are staying home due to back pain. So that's really affecting our productivity, even though there's not particular guidelines for ergonomics. This just shows how important of a topic is. And work loss days, about 5 million work loss days every year happen. So very important topic. Uh, Costs, these costs fluctuate. The first ones are in 2000 and 2024, the most recent ones. You could see all of these going up. So the annual cost now at $635 billion, with the average case at 47. So this has gone up quite a bit with workers' comp. It used to be about 11,000 a couple decades ago. Surgery costs, uh, again, going up. Each everything, it goes up about $85,000 a year for surgery. I think that's pretty accurate. Surprisingly, the one that hasn't gone up is, back pain takes the majority of our work comp dollars. So even though it accounts for about 20% of the cases, um, for all the injuries, they account for 90% of the costs. So, of these back pains, overexertion, trying to lift something too heavy, with that body not being able to handle it. So, at 65% of these back injuries are caused by overexertion. So, thinking of lifting this box that's way too heavy, too awkward. Um, so, usually in back injury cases, people are underestimating what they can do, and it causes injuries. Not to mention is usually it's multifactorial. There's a number of things that are built into it. People have pre-existing injuries. People see, personal well-being, whether that maybe they're too small to handle that load to begin with. Just so many factors involved. So for material handling, upper extremities, which we'll go over in a little bit, is number one with material handling at 37, back at 28%. Again, just work injuries in general, back is definitely number one. But when we're talking about material handling, remember this is using a force to lift something or pull something, those five movements. So then lower extremity and trunk are the next ones. So overexertion, so lifting something too excessive, back is usually the number one that's going to be injured at 61%. So definitely the most common by far of all of the five major ones. And then when we look at what kind of activities we're doing to cause these back injuries, and it makes sense that if overexertion is 61%. We're usually lifting something too heavy. And one thing I would always pointing out, you'll hear this over and over, is you're also lifting your upper body when you bend all the way down. So, oftentimes people could be lifting something light, like 5 pounds, but they're also lifting their whole upper body, something to consider. So other back injuries, slips, trips, and falls at 16%. So, and then, just going over, even though we did the anatomy, just a brief thing, very complex. We have the three regions. Each region is very particular for that part. So the lower back, the lumbar region, very built to bend forward. When we come to the middle back, it's more for that rotation, turning, and the neck, that turning mostly happens at the first two segments. So 80% of that neck movement happens at C0 and C1. So that's one thing. So the neck can be a little different, and then it has a very complex for more of a diagonal movements with the neck. So again, lots of groupings with the back, 8 major groups, and we kind of layer it in 3 layers deep, going to more that more exterior. Think of the lats, for example, latissimus for the middle group, and multifidus for that inner group. So each has a very distinct function. That middle group, are mostly for stabilization. However, those inner groups like multifidus, very fine movements, especially rotation. So something to consider. So the back, one of its major functions is that kinetic shock. Those discs are made to, take that compression. We uh, underestimate how much the back can really take. But then again, there's a reason for it. So many injuries because we take it for granted. 31 pairs of spinal nerves. So usually they come through those holes. When we get to L1, it causes a horse's tail, we call it. So it doesn't necessarily follow each tunnel at that horse's tail, called iguana. It kind of branches out into each one of those holes, but it's not as wrapped up finely. So definitely, a marvel on its engineering with the back that we don't often consider how many joints, 24 joints for, 97 joints with 24 vertebrae. So this is just going over those layers of the back. So this is that middle layer that I was talking about with the longest thoracic latissimus. Sorry to get my words jumbled here a little bit. One muscle that doesn't show that is very important is this psoas muscle. So it actually attaches to the front of the spine, going to mostly also originates in that pelvic bowl, but goes to the leg. So it's one of your main leg flexors. But when your back really hurts, it pulls on it. So that's why if a person has trouble from sitting and standing, it's that muscle holding on straight, not allowing you to sit up straight. So that's that psoas muscle that's often not talked about. Ligaments, so many ligaments. We got ligaments in the front and the back for car accidents, for example. Oftentimes we think of whiplash causing injuries to those ligaments, especially the ALL for the anterior longitudinal ligament, or the PLL. So that will cause those vertebrae to shift on top of one another. And so then you can actually have more compression on those nerves. And then we got muscles on the outside between each of those SP joints as well as the TP joints. So lots of ligaments with the spine. As far as the bone, remember that's the tertiary part of the injury. We talk about, so in the middle, the body of the vertebrae, each one of those nubs on the outside are your transverse processes, and the bumps you can feel as you go along the spinal cord as your spinal processes. So on this CT scan on the right, we can see transverse process where the spinal foramen canal is coming through, as well as the pedicle. That's usually kind of a hidden fracture, especially when we look at X-rays. We look for the Scotty dog, and if we see it between that pedicle of the vertebrae, where it will kind of have a color that can be indications if there's a fracture or not. So one of the classic examples of a spinal cord injury is Christopher Reeves. A long time ago was Superman. This is classic. He was doing on his horse with the English style and had an accident with that and landing and caused him paralysis. So pretty big injury, especially since he was Superman way back in the day. So movement is life, mobility versus stability. So when we think about the lumbar spine, they're bigger vertebrae. So we think of them more of a stabilizer versus the neck, a really smaller vertebrae, and we're thinking more mobility in those. So these are the trade-offs we have with the vertebrae. As far as the disc concerns, a lot of people say, oh, they blew out a disc. And so usually they're talking about there's different types of disc conditions. And usually it's a disc bulge is what they're talking about. So these fibers on the outside have not torn. And so those are the annulus fibers. There's 3 fibers on there and they crisscross. And so when it's totally broken through, we call that a prolapse. So that gel in the center is similar to a jelly donut, or, it's more fluid in there. It's mostly water, but it's there to help with the compression. But if it breaks through those 3 fibers, it can push on that nerve as well as cause a lot of inflammation. The body recognizes it as foreign, so it attacks it. Disc conditions, even though not as common for back, only about 10% of back conditions. We talk a lot about it because people at some point in their lives will have a disc condition. Oftentimes there's stats now that most people, if you just randomly took a x-ray, it would show a person has disc bulge. So it's not, this is where it gets complex, whether we're actually diagnosing it. That's where your history and symptoms come more into play of how it's impacting the body. So just an x-ray alone, definitely not enough. So the next step, usually, x-rays are taken for that bone, and they can be very important for fractures. The MRI is classic scenario to look at that prolapse disc. So this is a T2 weighted and the white in the center, and we look at the disc and it will, that black pushing into that white. So if there's no more white, we say that's a full-blown prolapse. There's different grades of prolapses. Just a bulge can be just a little blip on the outside. So this one here in the neck here, that's probably a bulge right there. As well as with the neck, we're looking at the alignment of the vertebrae. So that is a very straight neck. So you want a curved neck. Ideally, usually when we see that, a very straight neck, we're saying there's a lot of trauma to that area and the muscles are guarding. So it's actually creating, losing that curve. And so that's one example of something we look for is just the positioning of those bones that X-rays can be very convenient for. CD, a classic for soft tissue, but especially for internal organ damage, those type of things. But it can be more accurate with the bone. It just exposes someone to a much more radiation, at least 10 times more. The muscles, three grades of strains. So sprains is a damage to the ligament. A strain is a damage to the muscle. So grade 3 is it's completely torn. The only way it's going to heal is through a surgical repair. So not as common. So most of the time when we have a strain, it's usually a mild. That's going to take 3 or 4 weeks to heal. That intermediate, we do have tearing. The body can heal. It's going to take a little bit more time, 4 to 6 weeks. Pain, of course, with back pain. So working in a medical clinic, most people just diagnose it with back pain, and not necessarily wrong, but we could be a little bit more particular about this. And backs are very complex that you're getting a good feel for. And people feel pain very individually. So this is something we want to really home in on. Taking good history. What kind of pain do they have? That quality, is it burning? Is it sharp? Each is going to have a very particular, helping with that diagnosis. The intensity, often we rate it 0 to 10, 10 being severe pain. That one is very individual. If you ask the ER doc, attend to them, a limb being chopped off. They, want that severe case, that frequency. Usually we're going to say put it in 3 categories, but it just depends on what kind of practice you have. We can have constant happening 100% of the time, frequent usually more than 60% of the time, and frequent less than that. So give kind of a example of that frequency and duration, of course, is how long it's occurring. Is it occurring an hour? Is it occurring a full day, weeks at a time? Each is going to help with that diagnosis. So usually for treatment of backs, we got the RICE, so, rest, ice, compression, elevate type of thing that you can do at all your facilities as a safety professional. And I think I've seen a lot of movement to have people try to treat at the facility doing those simple conditions, see if they can recover fast, so we'll keep them working. If they go to a doctor, usually medications is a common one. I was just at a talk with opiates, even though the deaths with opiates have dramatically decreased. I think the last stat I saw, and it fluctuates quite a bit based on the state, 30,000 deaths every year, so it's still quite concerning. I see quite a bit of decrease. So the peak of the opiate deaths in the US at least was about 2012. And so what happened is that they really kind of got on doctors of not prescribing opiates so readily. And the disadvantage is there's not that many, even though there's lots of treatments out there, there's not really great treatments. So, having chiropractic experience, I think that's a great first start, but it's not made for the long term. Hopefully trying to get people past their pain and get a movement. One thing for NSAIDs, before we had opiates, they prescribed NSAIDs, and now they're kind of going back to NSAIDs because they don't have that. So NSAIDs, think of aspirin, ibuprofen, those type of things. So usually very safe. We could go out to the store and buy them, but the problem with NSAIDs is people take too much at one time and causing other conditions, whether it be ulcers or damage to the kidney, things we don't talk about. If they follow, that 2 pills every 4 to 6 hours, no problem. But I've been at a clinic when people are like, yeah, I just had 11 a day, and it's not made for that. And so people are having problems with NSAIDs. And so even though it's our full back, we need other treatments. So physical therapy, I think, um, we physical therapy has gained momentum. One of the things I like about physical therapy is that it's actually watching a person, making sure they gradually increase their movement, trying to get rid of that scar tissue. If you have, a strain, for example, um, doing very particular movements to help recover. And then the optimal is following up, making sure that has healed with x-rays and whatnot. But oftentimes, if people are good to go, that follow-up stuff doesn't happen. Okay, so uh, with this lecture, I hope that you can pick up that, there's back pain, especially with material handling, is very common. And the kind of those stats that pretty much all of us don't have back pain, upwards to 90%. So that's a lot. And then just give some examples of some back conditions, whether it be a prolapsed disc, strain, sprain, all of those, and some interventions we can apply to. Thank you. All right. Have a great day.